Can misinformation change public opinion on LGBTQ policy? Have you ever wondered how misinformation can shape the way we think about LGBTQ policies? It turns out, misinformation can have a big impact on public opinion, often in harmful ways. Misinformation refers to false or misleading information that twists the facts about LGBTQ identities, health care, and rights. This kind of distortion can influence attitudes, beliefs, and even policy decisions. At its core, misinformation often portrays LGBTQ individuals as threats to children or society. These claims falsely connect LGBTQ identities to harmful behaviors, like grooming or abuse. Scientific research has repeatedly disproven these ideas, yet they continue to circulate in public discussions. Such narratives create stigma and discrimination, leading to increased support for harmful policies aimed at LGBTQ individuals, particularly transgender youth. For instance, misinformation surrounding gender-affirming care, which includes medical and psychological support for transgender individuals, has been weaponized in political campaigns. False claims suggest that minors are receiving gender-affirming surgeries in schools without parental consent. In reality, these surgeries for minors are extremely rare and only happen after thorough medical evaluation and parental involvement. Despite the truth, this misinformation has fueled legislative efforts to restrict access to gender-affirming care and limit transgender youth's rights, such as bathroom access aligned with their gender identity. Misinformation also has serious effects on mental health and community safety. Stigmas and stereotypes driven by false information increase the risk of violence and harassment against LGBTQ individuals. This can worsen mental health outcomes, leading to higher rates of suicide among LGBTQ youth in unsupportive environments. The issue extends beyond individual attitudes, impacting the well-being of entire communities. From a policy and advocacy standpoint, misinformation complicates efforts to secure legal protections for LGBTQ individuals. It creates an atmosphere of fear and suspicion, especially in schools and public institutions, making it harder to implement inclusive policies. Advocates must work to counter misinformation with accurate information, supportive messaging, and evidence-based research to protect LGBTQ rights and promote acceptance. In practical terms, legislative advocacy against misinformation involves educating policymakers and the public about the realities of LGBTQ lives and health care. This includes exposing false claims and promoting laws that affirm and protect LGBTQ individuals. Community support networks and trusted voices play a vital role in providing factual information and emotional support to combat the negative effects of misinformation. Misinformation can and does change public opinion on LGBTQ policy by fostering fear, misunderstanding, and hostility. This influences legislative outcomes and the social environment for LGBTQ individuals, making the fight against misinformation a key part of advancing LGBTQ legal rights and protections.